Okay, welcome again to today's webinar. My name is Dr. David Kunashko. I'm the medical director at BIOFLEX Laser Therapy. We are a photobiomodulation medical device company. Most people know this as cold laser therapy or red light therapy. And BIOFLEX, the company, has been around for well over 30 years. In fact, we were the first manufacturer of this type of light therapy in North America. So the goal today, now I do two types of streams of webinars every month, typically. I do one for healthcare professionals, a little bit more in depth, using our professional grade equipment. And I also do one a month for our consumer level devices, typically ones that you would use at home to treat yourself. They are a little bit different, but they're all based on our professional equipment. The main difference is that in-home consumer use, unless you're a healthcare professional, you cannot use a high-powered laser. But fortunately for skin conditions, especially what we're talking about today, you really don't need a laser. In fact, it's probably better to use other light sources, and I'll talk a bit about that as well. Bit of housekeeping before I continue on with the webinar. These webinars are always recorded, then we edit them, and then they are uploaded to our website. Now, if you want to watch a webinar but can't make it, you can either go to our website or you can get a direct link to the webinar just by registering for the webinar, and we will send you out a follow-up email within a few days to a week with a link to actually watch it at home at your convenience. Also, I always have time for questions, so I do really appreciate the questions because we all learn from those. So if you have any questions along the way, just type them into the chat box, and at the end of today's session, I will address those questions as well. This topic is pretty interesting. I have a lot of people always ask me about it, and in part, it's because people see things, especially on social media, and then they start to wonder, well, can it really be true? Can it help? That kind of scenario. And the fact of the matter is it really can, but you need to know what you're doing. And so unfortunately, most of the devices that would be being sold out there, especially by influencers on social media, they're not paid, they're not experts in it. They're really literally paid to sell a product. And there are some key differences between the kinds of equipment that we sell, especially for this type of application, than ones that you might have see on social media. And I'm going to talk a little bit about that as well too. So I will mention our equipment because theoretically, many of you listening in actually do have our equipment. So this is a good opportunity to understand a little bit more about that. But also for those of you who don't have our equipment and are maybe thinking about getting into light therapy use at home in this case, then I'll talk a little bit about our equipment as well. And then I'll do an overview of the skin itself. It's good to understand a little bit about what it is you're trying to achieve and what this light therapy can actually do and why your skin is aging. Actually, I read a really interesting article in preparation for today's webinar, and very recent research actually has indicated that, it used to be that, oh, if you look old, say you have a lot of wrinkles or whatever, but you can still, be really healthy, deep to that, I guess you might say, which is true to some degree. However, they've also found that the more aging you have of your skin, that skin, those cells in the skin start to release certain types of chemicals that are absorbed in the blood and can have an effect throughout your whole body. And like inflammation and effect on organs, that kind of thing. So there is some correlation to if your skin is showing advanced signs of aging, that deep inside your body, organs, and so forth may also be going that way as well too. So while I'm not promising that you can reverse all this, but it is really important to understand to maintain a healthy lifestyle, do things that are natural, that makes sense, that have some efficacy or research behind it. That's really important. That's kind of what I focus on as well too. So I will talk about the research, and then specifically I'll talk a bit about how you would use the equipment and some do's and don'ts as well, because really that's probably why you're here, but you have to listen to me blab on about all the other stuff prior to that. and then I'll take your questions at the end. So our equipment, it looks something like this. This is an example of one of our light treatment arrays. This is a P120. There's 120 what are referred to as bicolor superluminous diodes. This is a hybrid between a laser and an LED. And because there's so many of them and they're packed so close together, they actually emit a fair amount of energy in a relatively small surface area, which is really good when you're using light therapy because you need a certain amount of energy to actually elicit a change. Also unique to our equipment only, there is no other devices out there that have two wavelengths in one diode. So they emit both red and near infrared out of one diode. For example, you might see other devices out there that maybe look similar, but what they are is they'd have a red diode, then say a near infrared diode, and then a red diode, and then near infrared and so forth. So they're kind of spread out, right? Whereas ours, each one of those can emit both those wavelengths. Now we do it sequentially. We do red, then near infrared, but you can pack them close together. And that's kind of what we're known for, is to get a high energy density or dosage in a relatively small surface area. Our equipment is actually designed, manufactured, and made in Toronto, Ontario, Canada. So unlike, again, I'm going to, talk about these social media influencers and so forth that just basically, or other companies for that matter, that just basically rebrand something sold and made in China or Taiwan or what have you relatively cheaply. They're not medical devices. They're not ISO 13485 certified. You have no idea if anything's accurate specifications, power, safety standards, all the rest of it. And our company, BIOFLEX, I know it sounds like a promotion here, but I'm literally telling you the differences here is that our company is an ISO certified 13485. So we're a medical device company. That means we're regulated and audited regularly. I actually just saw an email today about an audit, that we just had. So that's really important because what we say, the specifications, how we can market it is all regulated. We can't make promises that aren't based on research, and that's a big part of it. So as I mentioned, the light that's released from our equipment is both red and near infrared. And I'm going to talk a little bit about these wavelengths, but essentially red is really good for the skin because it doesn't really penetrate that deep, maybe 5 millimeters to 10 millimeters or thereabouts, whereas near infrared can go a little bit deeper. It can go perhaps several centimeters into the body. You might say, well, why would you even use near infrared for the skin? Well, it all depends. But in general, near infrared, it can get just deep to the skin and improve circulation and do some other things as well, including immunomodulation that's helpful for keeping your skin healthy. So using those two wavelengths, red and near infrared, are probably the best wavelengths to use. You will probably see equipment out there that has orange and green and the whole spectrum of lights. Don't buy into that. All the research, and I'm going to present it to you, uses red and or near infrared. They don't use blue. Well, blue is used for acne because it's bactericidal, but it doesn't go very deep at all. So not great for treating deeper into the skin. And then those other wavelengths, they're completely absorbed by blood. They're not traditionally used in what's referred to as photobiomodulation or red light therapy. And therefore, they don't make good candidates for this type of light therapy either. So there is no science or research behind using those other wavelengths. It is strictly red and near infrared. Those are the wavelengths used in the research for over 30 years. So I just want to make that clear. The controller to the device is fairly simple. You just choose your anatomical area. Now, of course, I'm not talking about upper back pain today or knee pain. And by the way, if you are interested in more about how you would treat some of these conditions with this equipment, we do have an archived series of webinars that I've done on most topics using this device. Just go to our website and go to support at the top, and you'll see archive personal webinars, and you can find them there. So very simple to use. You power it up, you plug things in, you have a start, a pause, and you would select the intensity stage. That's important because I'm going to talk a little bit about what you're going to select for when treating for skin rejuvenation, as we're talking about today. So these are our consumer devices that are clinical grade, you might say. So we have a P120, which is the white. We have a P180, that's 180 diodes. That's the black one. And then we have our mini port home system, which has a little bit slightly even bigger and larger, more powerful treatment array, along with a little bit more sophisticated software as well. This is a quote that I saw recently, and I thought it was really good. So, as the largest organ in the body, the skin can have a profound effect. The chemicals released by diseased and dysfunctional skin soon enter the bloodstream, where they essentially circulate or wash around, damaging other tissues. Amid the ensuing systemic inflammation, chemicals from the skin can reach and harm organs that seem entirely unrelated, including your heart and your brain. So it makes sense, right? The skin is the largest organ of the body. That's one of those trivia questions, right? And I have the reference below. And the research is showing that the healthier skin, that's showing that the healthier your body will be as well, too. Some fun facts about skin. The skin is, of course, the largest organ. It's about roughly 2 millimeters thick, although that does vary in different areas of your skin. And if you were to take all your skin off and put it on a scale, it's about 6 pounds, thereabouts. Obviously, it protects us against light and heat and injury and infection. We all know that. It helps regulate body temperature, gathers sensory information, it stores water, fat, vitamin D, plays a role in the immune system as well. And we all, of course, know that the color of our skin will vary depending on skin pigments. The thickness varies depending on the area of the skin, the area of your body, and the texture as well, too. And so there are essentially two types of skin in humans, both that are considered thin and hairy. So basically, those are the most prevalent on the body, and you can kind of figure out where those are. I'm sure you know that. It is made up of three layers: the epidermis, the outermost layer, the dermis, and then the hypodermis or subcutaneous region. And all three of these vary significantly in their anatomy and function. The skin structure is made up of essentially an intricate network, which serves as the body's initial barrier against bacteria and viruses and ultraviolet light and chemicals, mechanical injury. Also, as mentioned earlier, it helps to regulate temperature and, of course, the amount of water released into the environment. So if you look at this sort of microscopically, you can see the epidermis is the outermost portion, and it has a whole bunch of layers, starting from most superficial, the stratum, that's Latin for layer, corneum, lucidium, granulosum, spinosum, and basale, going deeper. And it's specifically the next layer, the dermis, that is probably the most important for what we're talking about today for light therapy, because the dermis, and you can see here, there's two layers, papillary and reticular. This is what houses fibroblasts, and these secrete collagen. And it's the collagen that, as we age and get exposed to sun, and you know the story, that our skin becomes thinner, more prone to wrinkles, right? And then, of course, that's why you're tuning in. So as we age, these fibroblasts lose their ability to do their job. Some of them die off. Some of them aren't functioning very well. And, you know, with light, it actually can stimulate these cells to release more collagen over a period of time and help overall with the health of the skin. And deep to that is a subcutaneous or fatty type of tissue, or the hypodermis. So keratinocytes are they're a predominant cell type of the epidermis. It produces keratin. Of course, that's the forms of water barrier. And they also help regulate calcium absorption by activation of cholesterol precursors by ultraviolet B light, which go on to form vitamin D. Melanocytes, which I'm sure everyone's heard of, they produce melanin. This is responsible for absorbing most of the UVB. So the darker our skin, the more protection from the sun. And of course, depending on where you were not necessarily born, but your genetics, the closer you are to the equator, the more melanin you'd have in your skin to help protect against the more intense ultraviolet B light closer to the equator. Langerhans cells, these uptake antigens, basically these are essentially proteins like viruses or other things that can potentially be dangerous to the body, and then they're transported to the lymph nodes, and then they're degraded by immune cells and eliminated. Then there's this really interesting cell type called Merkel cells. These are mechanoreceptors. So when you lightly touch your skin or pinprick your skin or what have you, or put pressure on your skin, it's these cells that sense that and send it to your central nervous system for figuring out what's going on, like a spider's crawling on you or what have you. A funny story is that so I have rear patio doors on my house, and there's this massive spider, an orb spider, that every day would build a massive web. I'd open the door because I feed these feral cats, and he has this little space he can crawl into, and he crawls into the space, and unfortunately the web is destroyed. And every night I go to open the door, it's only open so one way. And again, same thing. Like this guy rebuilds his spider web literally like within 24 hours every day, and it's like spectacular. So anyway, side story on the spider. All right, the dermis consists of two layers, papillary and reticular. Papillary is loose connective tissue, and the reticular, that's deeper. This is the one that has more dense connective tissue. It also houses sweat glands and hair follicles, sensory neurons, and blood vessels. And most importantly, for what we're talking about today, are collagen fibers. And deep to that is the hypodermis, and this is subcutaneous fascia, some fatty tissue or adipose. Again, some hair follicles, sensory neurons, and blood vessels. Let's talk a little bit about skin aging. So it's a complex process, and there's both intrinsic and extrinsic factors, some of which you can change. So intrinsic, essentially this is going to occur as a natural consequence of physiological changes over time. You can't really alter that. There's some inalterable, genetically determined issues there. So, some of us are blessed perhaps with, not necessarily me, I'm just saying some of us have good genes and, maybe look younger than your years, whereas others, they hit 30 and maybe they look older or whatever the case may be. Extrinsic factors, well, these are controllable, right? Like smoking, for example, is known to age your skin. And pollution, same deal. Excessive sunlight, repetitive squinting or frowning, certain aspects of your diet. They even say your sleeping position, on your one side of your face, that's how you always sleep, that it can affect that as well too. And in general, your overall health. So it's together all these factors that will play a role in aging. By the way, I've seen some questions below. I haven't gotten to them yet, but I will definitely get to them at the end of the webinar, and you can just keep typing them in as we go along. So histologically, this is just a fancy term for cells and the study of cells. Aging skin typically shows epidermal atrophy. So that's sort of dying off due to decreased cell numbers. So here's the thing. As you get older, your cells die, except for cartilage in your nose and your ears, apparently, where that continues to grow. But in general, cells have a certain ability to replicate, and then over time, they lose their ability to do that. And we can only replace them so much. So that's why it's important to, whether it's your brain and using your cells or other aspects, is to try to stimulate your cells as much as possible. And photobiomodulation or red light therapy is actually one way that's proven to do that throughout your body. The dermis of aged skin shows decreased numbers of mast cells and fibroblasts. Remember, it's the fibroblasts that secrete collagen. These are the key to what we're talking about today. Now, fibroblast deterioration contributes to skin aging by secreting enzymes that impair the release of essential growth factors and enhance the degradation of what's referred to as ECM or extracellular matrix. It's kind of like jello or jelly that makes your skin firm. And then activation is something called matrix metalloproteinases, MMPs. Again, you don't need to know that, but I will tell you this, is that all the research has shown that MMPs are decreased when the cells are exposed to the correct wavelengths and dosage via photobiomodulation therapy. So there are several molecular mechanisms that affect skin aging, including what's referred to as telomere shortening. You may have heard about telomeres. My background is genetics, by the way, so I find that pretty interesting. But essentially, that's in genes, and where the connection the um, uh, of the chromosomes are made. Oxidative stress, MMPs, as I mentioned, cytokines, autophagic control. That's basically the ability of cells to undergo growth or death, and microbiome. They're all very important. So now we talk about light in general. Light penetration for what's called PBMT or photobiomodulation or red light therapy is not necessarily, the depth of how deep the light can go. It's how dense that light is. If there's enough light to get to the area that you want to stimulate. The reason why I mention this is that almost every almost everything I see on social media talks about using equipment that doesn't touch your face. You put it over your face. There's a dome over your face, or a mask, but it's recessed, right? Those kinds of things. They're not ideal because the light bounces off your skin. So if the diodes are any distance from your skin, and those masks, depending on how they're made, I mean, some are actually better than others. And in fact, we're actually we've been designing one, so that should be coming out soon. They have to touch the skin. And if they don't touch the skin, and if there's not enough of the diodes, then they're not going to do really what you want them to do. So that you have to touch the skin. When you do that, that light is able to actually be absorbed and penetrate deeper into the skin. Otherwise, you're going to reflect the light, and up to 85% of light is just bounced off your skin if you don't actually touch the skin. So as I mentioned earlier, different wavelengths of light, whether it's red, near infrared, yellow, orange, blue, violet, they all penetrate at different depths. And the best one to go through the skin and especially into the dermis and accumulate energy is red and near infrared. So most therapeutic modalities that you've heard of, this is like retinoic acid or dermabrasion, chemical peels, using higher powered lasers. They all depend on some form of controlled epidermal removal. So essentially, you're burning the skin, and then as the skin has a wound, it promotes collagen biosynthesis and dermal matrix remodeling. Does it work? It does, but it's invasive. And by the way, if you choose to do that, that's okay. I would use red light therapy after, because that will heal it up way faster, like much faster. In fact, a lot of sort of cosmetic surgeons, that kind of specialists doing these types of things, they're now on to the whole red light, although they probably don't know anything about it. Some of them do. I shouldn't say that, but a lot of them don't. They're actually providing this for their patients for recovery after these types of procedures as well. So again, these procedures, if you go about them, there are risks, right? Infections and pain and bleeding and oozing and all sorts of things. So today's method is a little bit, completely less invasive, or non-invasive, you might say. So photobiomodulation has been shown. By the way, we're going to go over, Tom. I know it right now. So I'm letting you know that we'll probably finish closer to one, because I'm just realized that I'm talking a little too fast, or too much here. So photobiomodulation can really help with skin conditions like wrinkles and skin laxity. And essentially, it does this by being absorbed directly by these fibroblasts to control collagen. Is it complicated? Yeah, it really is, to be honest. And I'm not going to sit there and explain all the stuff that's going on inside the cell. I've done that. I have many webinars on that. You feel free to go and investigate that. But I do want you to understand that what I'm talking about today is backed up by some really good research. So let's delve into that a little bit. This particular paper is on photobiomodulation, the clinical applications of low-level light therapy. Dr. Glass, he's actually a plastic surgeon, so that's actually quite interesting. Here's just one of the case studies that he presented in his paper. You can see that before and after, a 73-year-old female treated with a home use device, dual wavelength. Sounds familiar, right? 680, 808 nanometers. If you're not sure, that's red and near infrared, basically the same as what is in our equipment. Treatment for about 20 minutes a day. And they did this for 12 weeks. Okay, so almost daily or most daily treatments and for 12 weeks. That's about 3 months, right? You're not going to see any changes in a week or two. So don't get all upset if you're not noticing any changes. We're talking 2, 3 months before you see these types of what are quite obvious improvement. Not drastic like a facelift, but certainly an improvement. This next one was a split face clinical trial. This is, I always find these interesting. So split face means part of your face gets treatment, part of it doesn't. So I guess you're going to have a better, you want to be photographed in a certain angle. So they did 76 patients, so a much larger type of trial with facial wrinkles, and they were treated with LEDs. So most of the time in the research, they use LEDs that touch the skin. Notice the wavelengths here. They did 830 and 630, again, almost identical to what BIOFLEX uses. And again, in this case, they're treating twice a week for 4 weeks only. I recommend more treatment than that, but I'm surprised that they still got quite good results. And they also looked at some of those chemical mediators I mentioned earlier. I won't talk all about these details, but they actually measured the MMPs, which is a sign of inflammation in the skin and aging. So if those go down, that's better. And here you can see the results. Now they're kind of subtle, and in part they were subtle because they didn't treat enough, in my opinion, but you can still see a difference here. You can see baseline, and you can see that sometimes it's called crow's nest or whatever. If you look carefully, you can see these lines, and then this is 3 months later, you can see less lines. I mean, maybe it's about a 40, 50% improvement, but it's a definite improvement. So quite noticeable. And again, no facelift, no ablation, no injections, no costly visits to your local plastic surgeon. And so what they found here was that they showed significant reductions of wrinkles, so up to 36%, increases of skin elasticity, up to 19%, and compared from the baseline in the 3 treatment groups. Histologically, a marked increase in the amount of collagen. Again, that's what you're looking for, and elastic fibers in the treatment groups were observed. Ultrastructural examination demonstrated highly activated fibroblasts. Remember, it's the fibroblasts that secrete collagen. That's really your target for this type of light therapy. And they were surrounded by an abundant elastic and collagen fibers. That's what you want. You want more of that in your skin. It was well tolerated, no adverse effects. Good thing about photobiomodulation is that there are no known side effects. If you feel something weird afterwards or you have a headache the next day, it's doubtful it's caused by the light. And if it was by chance, maybe a little eye irritation or something like that, it's transient, it will go away, and it will not cause any harm. So they concluded that both these wavelengths are effective in an approach for skin rejuvenation. Here's another one where they looked, again, using LEDs, 13 subjects, fine lines. They used something called a Glow-Gauss scale, photo damage, 2 to 3. I don't know really what that is because I'm not a skin specialist. And again, guess what wavelengths they use? 633, that's red. So there is not one golden wavelength. It's in the red range, 630 to 680 in that range. And most research uses that, usually 660, but sometimes 638, depending on the LED. 830 nanometers. But what I want you to pay attention to are numbers like this: 126, 66 joules per centimeter. That's actually should be squared respectively. That's a dosage. When you use equipment that you have no idea what the dosage is, you don't know the power, even if you know the power, is it accurate? You don't necessarily know how many joules that is coming out of your equipment. You may be touching the skin, you may not be touching the skin. There's so many variables, and then it doesn't work. You've invested $59.99 in Amazon and go, well, I guess it just didn't work. That's how they get you, right? It's so cheap that you think, oh, I'll give it a try. It doesn't work. Oh, well, whatever, $60, right? That's the problem. You need a device that that emits the dosage that's from basically based on the research that's going to give you those results. So here's another example. It's subtle, but you can see an improvement by week 12 in the fine lines and wrinkles here. I don't know if you can really see that on your screen, but there is some improvement there. And again, this is the forehead. This is a little bit less subtle. You can see the forehead wrinkles decreased. Okay. So again, the whole idea here is doing something natural, helping the health of your skin. And although you might think, oh, maybe there's some vanity here. Well, I suppose, but remember, healthy skin, healthy body, right? So you can also say that you're treating, underlying treating your systemic body as well, too. So they found that overall, there was moderate 50% or slight 25% response to treatment at investigator assessment. Treatment of the periorbital, that just means around the eyes, was reported more effective than the nasolabial region. That's mainly because the creases around the nasolabial area, like your mouth and your nose, they're a little deeper, a little bit harder to really see a lot of changes in that. So a little bit more challenging to do much with that, although with time, you will see an improvement with that as well, too. And then at the 12-week follow-up, 91% of subjects reported improved skin tone, 82% reported enhanced smoothness of skin and treatment area. There you go. So if you invest 14 minutes, 15 minutes a day, I'm going to get into this, then it should be helpful for your skin health. Last study, this is again regulation of skin collagen, pulse 660 nanometer light. Split face study, 40 healthy patients with aged photo-aged skin, 37 women, 3 men. Gee, I don't know. I tell you this, I play squash and so someone was asking me, they said, oh, I just ordered some stuff from Amazon. I want to treat my wrinkles. And this guy is, I don't know, maybe 55 to 60 or whatever. And so it's a man, right? Like you don't normally hear that kind of talk amongst guys or whatever. And then another one said, oh, does it, because they all know I'm kind of an expert in it. And then they asked, oh, does it help with the, with the eyes, like, sometimes you have the sags in your eyes or some other things. And then before you know it, all these guys were asking me. So yeah, it's not just women, it's men that want to appear a little bit younger and healthier for sure. Wavelength used, 660 nanometers. Okay, in this case, they just used red. And then you can see very specifically the dosaging that they used. So again, you can see pre and post. So pre, you can see the lines here, right? Okay, there's a control. And then post, you can see less lines. And the control, I don't know, looked about the same. Kind of set on black and white photos too. I don't know why they did that in the journal, maybe to save some money, but yeah. So it was helpful, more than 90%. Again, I see you have questions. That's awesome. I will get to those very shortly. 90% of individuals showed a reduction in skin wrinkle. I guess that's the medical term, righted. I didn't even know that. Depth and surface roughness via a blinded clinical assessment. 87 experienced a reduction of the Fitzpatrick wrinkling severity score. See, Fitzpatrick, he was concerned about his or her wrinkles after 12 LED treatments. Very quickly, now look, we specialize in photobiomodulation for clinical medical conditions. So over the years, it's not like we focused on this type of thing, but along the way, we did some because people asked about it. This isn't the best quality picture, but this is, and it's quite old, but this is a lady that received treatment in our clinic, and you can clearly see, now she was getting other work done, like for other conditions, medical conditions, but she goes, oh, hey, will it work on wrinkles? And our owner, who's since passed away, Dr. Fred Kahn, he goes, yeah, it's going to help. So he treated it, and take a look. Look, you can see, visibly see, even though the picture's crap, you can see less wrinkles and a better healthy tone on her face, right? Like, and that was coming into clinic for treatment maybe every 2 or 3 weeks, or sorry, 2 or 3 times a week or thereabouts, as opposed to every day. Whoops, I'm going to back up a bit here. This shows, this is a close-up on the left. Those are striae, or like stretch marks, right? And that is the before and after picture. and you can see actually an improvement. Unfortunately, it's not the best picture, and I do apologize for that, but some of these case studies were really old and they were from photographs. I had to take a photograph of a photograph, so not the best. I do apologize for that. This is a little bit more a little more clear. This is stretch marks shortly after pregnancy. And you can see quite nicely how the stretch marks and the essential damage to the skin and the abdomen is really improved. And this was just a few sessions with, now this was professional grade equipment, but pretty similar to what the P180 would be or the P120 over 8 days. Quite impressive. So let's talk about how you would use equipment for the next 10 minutes or so, and then I'll take the questions. In preparation for light therapy, want to make sure your skin area that's being treated doesn't have any skin cancer or precancerous skin lesions. That's really important. See a dermatologist, see your doctor if you have any questions about that. That is something you don't want to apply light to. It's contraindicated. If you're not sure, make sure you see your dermatologist. This is not a medical advice webinar, but we should all be aware of our skin health, right? So if you live with someone, make sure they check their back or whatever. Otherwise, train your cat or your dog. You know what? Train your cat. Dogs, not too bright, but the cats, they could probably, if you train them, they'd be able to look at your skin where you can't see and look for things like changes in the diameter or darkness. Look if it's evolving or growing. These are potential signs of melanoma. If there's any bleeding or itching or crusting. A is for symmetry. I got that backwards, by the way. I guess put the slide in backwards. So melanomas are usually asymmetrical. That's kind of how they tend to look. B is the border, so they tend to be uneven. Okay, and C is for color, multiple colors in that sort of a lesion or what have you, right? So these are some of the things that you should be looking for. And if anything looks suspicious, get to the doctor, do a biopsy, and take care of that if need be. Avoid treatment directly over the thyroid gland. I got this question earlier. Someone emailed me. Someone also, sorry, and I forget the name now, who emailed me. They have different equipment, so I will respond to your email separately, but you can use your equipment similar to what we're doing today. You want to avoid treating directly over the thyroid gland. It can affect the function of the thyroid gland. So if you're going to treat around your neck area, then you can just block it out by putting a small little dark towel or maybe some tape or something like that. And I have seen devices out there that wrap around your neck. They're designed for that. I've seen them out there. I don't know. Like, I did read a paper that showed that it didn't have any effect on the thyroid functioning. It's a gray area, but I still teach it as a contraindication because it's known to increase the function of the thyroid gland. And so I wouldn't want to say, oh, don't worry about it. I would prefer just block that small area, right in your Adam's apple, a little bit on either side. It's not a big area. You can block it out pretty easily. In preparation for treatment, make sure that the skin is washed. Make sure you remove any creams, lotions, makeup. This can all interfere with light absorption. It can muck up your equipment as well too. So good idea to make sure your skin is nice and clean and dry. Remove any earrings, necklaces, any hardware you have embedded in your skin nowadays, right? As it can reflect light and decrease absorption into your skin. Wear your protective goggles. Now, this light is not coherent laser beams. It's not going to damage your eyes, but it can kind of irritate your eyes. It's bright, especially the red, and you don't want to look at it, stare at it for any period of time. Now, of course, you're not doing that anyhow when it's applied, but wear those glasses. Close your eyes during treatment. It's pretty easy to treat your forehead and around your cheek. Now, if you want to treat around the periorbital region, you're going to have to invest in these protective goggles. What I suggested there is that you use these, they're kind of used, if you know those suntan boosts that they used to have. I don't know, maybe they still have them. And you would wear those to block out the light. So if you wear these, then you can kind of put the equipment a little bit closer to your eye with the eyes closed. Those are 100% block out, and there'll be no issues at all there with any eye irritation. What protocol would I recommend? The phase protocol at level 2. This gives out about 6 minutes of red light, continuous wave. So it's kind of the highest dosage of red light that we have, which is what I'd recommend. 6 minutes is a pretty good length of time, and that's followed by 8 minutes of near infrared. Notice the wavelength, 660, 840 nanometers, and notice that's pretty much the same as the research I showed you earlier. And we do pulse out the light for the near infrared. We have reasons to do that I won't get into, but I think that's also very helpful as well. So I'm going to say start with this level 2, and do it for at least 2 months or so before you decide to change anything. I'll tell you how to change it in a second. The best position I find is just, no, I'm not saying I do it. No, I do. Once in a while, throw it on there. Is just lie on your back and gently place it on. And you can do it sitting up, that's fine, but it's a little harder to keep it in position. You may have to hold it in place. You can use inventive ways of keeping it in position. Again, maybe train your cat to put their paws and hold it in position. Dogs have too big paws, right? So, and you need to make sure it's in good skin contact, right? If it's not good skin contact, some of that light won't be absorbed as well. Now, I do appreciate you're not going to make 100% contact everywhere, but most of those diodes should be touching and pressing into your skin, allowing for that light to penetrate and go into your skin. And you may have to use a few placements, like if you're doing your forehead, and if you're doing the longer array, like that P180, will cover, both sides of your face, even around your mouth and your nose pretty easily. So you need to allow the entire treatment to run through. That's red and near infrared. That's about 14 minutes of total treatment time before you move it to the next position. The equipment may feel a little bit warm during the treatment. That's okay. If it starts to feel hot, like afterwards, or you're running consecutive treatments, let it cool down for a few minutes before you use it again. The thing about that is it's not the light diodes that's creating the heat. It's electrical current driving the diodes. They are designed to let heat escape through a heat sink, which is basically grooves in the equipment, but they can still get a little bit warm. So just a word of warning for that. Let them cool down a little bit. So the research consensus, as I've mentioned, is that skin rejuvenation treatment really doesn't need to be done over a period of time. Now, I did show you 1 or 2 cases that it was a little bit quicker. You saw some results, but in general, I tell people 2 to 4 months, right? Treatment frequency daily, minimally 3 times a week. I prefer 5, 6, even 7 times a week. So most days. You can skip the odd day, but if you're only doing it once or twice a week, I don't think the results are really going to be that noticeable. And then again, optimal results require consistent treatment. If you do it for a week or 2, then you stop, and then you try, no, it has to be consistent, part of your routine. Meditate while you're doing this, or don't read a book because you need your eyes open for that. Listen to some music, and take it easy. I would take close-up high definition photos of the area so that you can compare the before and after. Don't do it every day. Just take your initial photos, same lighting, same distance, and then maybe every few weeks take a picture and you can observe any changes. It's critical to do the same angle, same lighting, same distance. Otherwise, it's hard to really keep track of things. Big picture here, make sure your skin has no lesions, no precancerous issues, anything like that. Get it checked out with a dermatologist. Make sure your skin is clean. Ensure good skin contact, and be patient, right? Because it's not going to happen overnight. If level 2 isn't doing it for you after 2 or 3 months, or at least not as much as you'd like, maybe you look 30 instead of 20, like say you're 60 and now I look 30, but I want to look 20. No, I'm just kidding. If you don't notice huge amount of difference, bump it up to the next level. That's 3. That's a little bit more dosage of the infrared. Okay, next webinar is a professional level webinar, but anyone and everyone is welcome to join in. And it's on, can laser therapy really grow hyaline cartilage, like in joints? Spoiler alert, it can. So if you're interested in that, I would tell you all about that and how it does that with photobiomodulation. We're having a masterclass in November the 9th, on November the 9th. And the topic of this class essentially is case studies and all the protocols that were developed by our BioFlex clinicians, unique cases, and they're going to share those protocols with the audience so that you, as a clinical takeaway, you can, have all these new protocols, put them into your software and use them whenever these cases come on, knowing that your fellow peers, your clinicians, fellow BioFlex clinicians have gotten good results with that. It's in King City, just north of Toronto. Really great venue, really great food. Will be a fun day. We'll be showing all our equipment. We have new equipment to show as well too. So mark that date, November the 9th. Come out and see us. We do really appreciate your support, and that should be a lot of fun. If you want to email me, that's david@bioflexlaser.com. I don't do sales. However, if you're interested in the equipment, contact Sarah, sarah.salem@bioflexlaser.com. And I see a ton of questions here, so I'm going to see what I can get through here. How can we avoid the red light on our eyes during treatment using therapeutic or personal models? So I think I covered that using the glasses or the goggles. How soon after surgery can you use to heal scars? How often should you use it? Literally, as soon as it stops bleeding, you can start treating it with light therapy. And I would treat initially twice a day, 6 to 8 hours apart, until you start to see good closure of the wound, and then daily, and then go to 3 times a week. Also, after weight loss, would it help skin tightening? Yeah, definitely. As I've showed you earlier, I see a lot of eye treatment. How are you getting close to the eye without irritation? I have the wave zone. How long for full body daily? What setting? Is there a different setting for the face or the rest of your body? I get headaches if I do my face maybe too close. Yeah, you might be too close. Kelly, can you email me directly? Because it's a little bit different scenario with the zone. You can achieve some results there for sure. It's not my ideal choice, but you can still get some improvement. But it's a distance thing, so please email me on that. So someone here mentioned that they've used the Excel beauty protocol. That's the one I do recommend. 3 times a week and notice an improvement in the skin and around my eyes. So it did improve. Thank you, Renata, for that. And that was 3 times a week. In general, those LED panels, no closer than 10 centimeters to 20 centimeters. That's kind of the range. I'm not sure how close you were getting to that to you. And if you're getting headaches, use the blockout goggles. That will completely block out all the light. It's a bit of an investment, but it's worth it if you're getting some irritation that way. Can you use the laser for tightening age spots or sunspots or lightening age spots? Um, I don't I don't think so. I'm gonna have to read up about that because I think I saw one article, but I don't know. I don't think so. I think you're better off using retinol. Here, look at me. I'm an expert in in cosmetic stuff, but I read. What I want to know is which settings to use and how do we protect our eyes? I covered that. Sorry for all the boring information before that. Can you use the BioFlex Pro on face or wrinkles? Yeah, you can. Can you use this device once a week after cryotherapy? I think so, yeah. That would make sense. Why don't you have photos of the P180, for instance, on a face? Uh, okay, I don't know why, but you can use it on your face. You can use it for TMJ. We have a facial protocol. You can treat TMJ and sinusitis. So I mean, can't have photos of everything, but when putting on your forehead, can you have this over your closed eyes? Again, I'm recommending that you block out your eyes completely because it can irritate the eyes. It's not going to, it's not like a laser to damage your eye. What about maintenance treatment after the initial 2 to 3 months? Here's the thing, we continue to get older. So maintenance wise, you just continue on 3 times a week would be maintenance and minimally. So yeah. What protocol for the BioFlex therapist? No face protocol on it. Mary, you can email me on that one. Can you use a CU4 model for your skin? Yes, you can. Carol, I think there's a dermatological protocol there, but you can email me. How to use the BioFlex Wave if you need to have direct contact with your skin? So the BioFlex Wave devices aren't designed to touch the skin. They're used more for wellness or systemic effects. It can have an effect on your skin, And if you watch my webinars on it, the training webinars, you'll see that you don't touch it to your skin. That's not how they're designed. They're a lot more powerful. So to some degree, you counteract loss of reflection of light because they're more powerful. But because they don't touch the skin, you don't get as much light into the tissue because you're not depressing it into the skin. Because if you have a greater surface area, you can have a good systemic effect. I walked through all of that with the webinars on that as well. Can you just close your eyes without the glasses since the laser light doesn't damage your eyes? Well, you can do what you want, but I've already told you what I recommend. So, I mean, I don't recommend that because what if you open your eyes? What if your dumb cat jumps on you while during treatment and you open your eyes? It's not like going to blind you, but it's like super bright. So I would just go ahead and do what I recommend as far as safety goes. Uh, does the probe from your equipment on the professional mini port have any benefit for wrinkles? The red one would more so. If you have the red laser probe, you could use that as well. But to be honest, it's the array, the large array, the dual array in the professional equipment that I recommend for wrinkles. Excellent result. I had sinus infection and post-nasal drip. A few treatments done, was really happy. Hey, Sylvia, if you're happy, email sarah.salem at BioFlex Laser. Let her know. Maybe she can do a little testimonial. I mean, that's kind of what we live for because it's important for people to see the kind of results that you can get. The panel 6 to 8 inches. Yeah, so I say 10 to 20 centimeters. But if you find the LED panels are kind of irritating, then use the blockout goggles. Okay, that was that. Let me just see if I have other questions here. Questions. Oh, no, what happened? Oh, you know, I hate Zoom webinar. All right, I can't see all the other Q&As. For some reason, it's not working. Sorry about that. If you have any further questions, let me back up a bit here. Just email me. I do apologize for that. I'm sure my email box will be flooded. Thanks again for joining me today. Should you have any questions about sales, that's not me, that's sarah.salem at bioflexlaser.com. And hope you enjoyed today's webinar. We shall see you next time. Bye now.